Learn Chiropractic, Part 4, Spinal Evaluation, Motion Palpation. Motion palpation involves feeling spinal segments while they are in motion, whereas static palpation is done with the spine not moving. It gives more information on how a vertebral joint is oriented and functioning. Using your thumb and index or middle finger, gently and firmly press over the vertebral facet joints. Use your other hand to control the movement. Then have the patient move in the direction of the motion you are testing: rotation, flexion, extension, or side bending. Besides feeling for smooth joint movement, note any restricted movement in any direction, excessive vertebral movement or ligament laxity, clicking sounds, and muscle knots. Palpating the Occiput-atlas articulation. Gently push into the joint as shown. Compare ease of movement bilaterally. An occipital subluxation can manifest as head tilt and/or neck pain near the hairline on either side. Next, with your fingertips pressing into the joint line, use your wrists to rock the head over the atlas gently. Feel for locking on either side. Palpating the atlas or C1. Locate the transverse processes of C1. They will feel like a small bump just under the mastoid process. Press the tips of your index fingers over them firmly but not too hard, and rock the atlas as shown. Feel for fixation or lack of give on either side. Assessing cervical rotation. Using your fingertips, rotate each individual vertebrae while using your other hand to guide the patient to turn her neck as you palpate. Assess rotational movement to each side. Feel for any restrictions. Assessing cervical side bending. Grasp the spine as shown. This time, use your thumb to push the side of each vertebra to its full range of motion as you bend the patient's neck towards you. You can use your index finger for the other side as you bend the patient's neck away from you or switch sides. Assessing cervical flexion and extension. Place your thumb and index finger as shown in a pinch position. Press into each individual vertebrae from C1 down to C7 to its end range of motion as your other hand guides the patient's neck into one flexion and one extension per vertebra. Feel for locking. Assessing thoracic rotation. Press on the transverse process of each thoracic vertebrae and rotate to left and right to end range of motion, using your other hand to guide the patient's thoracic spine into left and right rotation. Feel for hard restrictions. Assessing thoracic side bending. Press on the sides of the spinous processes of each thoracic vertebra as shown, pushing to end range of motion as your other hand guides the patient into side bending towards you. Feel for any restrictions. Assessing thoracic flexion and extension. Place your fingertips between spinous processes as shown. Using your other hand, guide the patient into thoracic flexion and extension. You should feel the spinuses separate on flexion and pinch your fingers on extension. Segments that do not pinch suggest a fixation. Assessing lumbar rotation. Rotate one side of each lumbar vertebra as shown while using your other hand to rotate the patient. Feel for restrictions. Assessing lumbar side bending. Press into the sides of each lumbar spinous as you use your other hand to guide the patient into side bending towards you. Lumbar spinuses slightly rotate towards the side of the bend due to their architecture. Feel for lack of spinous movement. Assessing lumbar flexion and extension. Press your fingertips between lumbar spinous processes as shown. Using your other hand, guide the patient into flexion and extension. You should feel the spinuses separate and pinch together. Ones that don't suggest a fixated segment. Have the patient turn her neck all the way to the left and all the way to the right. Observe for any signs of difficulty. Take note of the approximate angle of her maximum range on both sides and compare. A wider angle could be a cervical fixation or contracted neck muscle. Do the same for cervical side bending. Make sure the patient does not rotate her neck as she bends. Instruct her to keep her nose pointed forward during the movement. Compare the max range of motion for both sides. Next, check cervical flexion and extension ranges of motion by having the patient bend her neck forward as far as she can, then backward. Next, check thoracolumbar flexion and extension. Have the patient bend forward at the waist and curve her back till her chest touches her lap. A raised side may indicate scoliosis or rotational subluxation somewhere in the thoracic spine. Then have her come back up and extend her lower back fully. Note any difficulties. Have patient sit up straight and bend her spine sideways to the left as far as she can go and then to the right. Instruct her to not raise her buttocks off the table so that all the motion comes from the spine. Note any asymmetries in range of motion. To check thoracolumbar rotation, have patient cross her arms as shown and twist as far as she can to the left. Visualize the distance from her shoulder joint to her spine at maximum rotation. Test the right side and look for asymmetries. After evaluating the patient's posture and performing static palpation, motion palpation, and range of motion tests on the spine, you should have a good idea of which areas need adjusting. Orthopedic and basic neurological tests are done next to gather additional information. X-rays of the spine should be taken whenever possible and correlated with all exam findings.